So, talking about specimen collection for semen analysis. The specimen collection or for collection of specimen for semen analysis, it requires a whole lot of sensitivity and professionalism. Yes, it's only professionals that can actually do this. And also, it requires written and verbal instructions provided to the patient. So, before one carry out semen analysis, before even discussing the procedures, written and verbal instructions be given to the patient, because if these instructions are not strictly adhered to, what you get is a wrong result. So what do we inform the patient about? First, we need to inform the patient about sexual abstinence. Before you go on with semen analysis, you tell the patient to abstain from sex 2 to 5 days and not more than 7 days before the ejaculate of the specimen is actually carried out. And also, the patient should actually collect the semen by masturbation, or through masturbation. So the patient masturbates in order to collect the semen. Condom should not be used. Why condom is not used in this case is that condom contains spermicide. Spermicide are actually chemical substances that kills the semen. So we don't want these sperm cells. Killed. We want them mortal, so we can be able to do proper evaluation. So that's why we don't use condom. If we should use condom, we should use condom that doesn't contain any spermicide. An example of such condom is silatic condom. So that condom actually does not contain spermicide. But to rule out or to negate errors, masturbation is best advised. And also, the container given to the man for the collection of semen should be white mouthed, it should be sterile, and should be leak proof, meaning there should not be any leakage. It should not contain substances that will either kill the sperm or reduce their motility, and it should be wide mouthed for easy dispensing. And also, the temperature at which this is done is actually very, very critical too. The temperature of 20 to 37 degrees Celsius is actually required, because if it is above or below, if it's below, it actually leads to cold shock of the sperm. So it should be temporarily warm or slightly warm, but not too cold. And the specimen container you're giving to the patient should be correctly labeled, and the request form must match the specimen container. The name on the request form must match the name of the specimen container, and must be labeled with the patient's name, the period of abstinence, the date and time of collection. The date and the time is imperative. Time collection is crucial in evaluating liquefaction and sperm motility.